Good morning, Miss Mitchell. My name's Abigail, the nurse practitioner. I'm going to be the one seeing you today. I reviewed your chart before coming in here, and I see that you're here today for feeling tired and overwhelmed. Can you tell me more about that?
Yeah, so super exhausted lately. My mom was diagnosed with early onset of Alzheimer's. So just taking care of her and, my family, my husband, my kids, it's really detrimental. I'm pretty tired.
Yeah, that's understandable. Are you experiencing any other physical symptoms alongside your fatigue?
Yeah, so I've been getting some frequent headaches. I've been having some trouble sleeping at night. My heart kind of races, and I've been feeling pretty anxious lately as well.
Thank you for sharing that. I'm just going to write those down, okay? Are you able to take any time for yourself?
No. I really don't know where to start with time. I feel pretty guilty. My mom requires quite a bit of my attention, so there's not much time for myself, really.
Yeah, that's understandable. Caregiving is very demanding. Well, maybe let's explore some options to help you manage that, okay?
Okay.
Can you walk me through what your normal routine looks like?
Yeah, so I get up at about 5 a.m. I get the kids ready for school. I work from about 8 to 5. I go grocery shopping, run some errands, come home, make dinner. Once that's out of the way, I make sure my mom has all her medications. I get her comfortable and situated. So by the time all of that's done, I really don't have much time for anything, and I'm pretty exhausted by then. So.
Yeah. Well, thank you for sharing that. Does anyone ever help you with your mother's care?
No, not really. My siblings all live out of state, so I don't get much help there. My husband does help a little bit, but he works long hours too, so I feel kind of guilty asking him to help out a lot. So.
I think a lot of caregivers feel the same way that you do, and it sounds like you might be experiencing caregiver burnout. Is that a term you've ever heard of?
I've read about it, but I just didn't think it really applied to me.
Yeah.
I kind of just try to push through everything and get everything done that I need to. So.
I think many caregivers feel that way. But, burnout can affect our health, so we want to make sure that we're doing things to find support and support ourselves. And I would just maybe like to talk through some strategies to help you find that support that you might need for your mom, okay?
Okay.
So we have respite care and other local services. Would you be interested in those?
I think so, yeah. I don't really have a choice at this point. Yeah. I need something, so.
Okay, well, let's put some resources together for you. We have options there's adult daycare, there's home health aides that can come to your house and help take care of your mom. So we can give those resources to you, so you can maybe look into that already.
Okay.
Just to get you some relief with your mom, okay? But I am going to want to follow up with you in a couple of weeks, alrighty? But before you go, I am going to go ahead and do an assessment, alrighty?
Okay, that sounds good.
Alrighty. Hi, Sarah. I'm so glad you're back to see me. How are you doing since we last spoke?
I'm doing a little better. Still kind of hard managing the day-to-day. I still feel guilty asking for help from my mom, so, but it's gotten a little better.
Yeah, I think feeling guilty is a little normal. Have you been able to explore some of those respite care options we talked about?
I did. So we've been kind of considering the adult day program, maybe once a week.
I think that program is really great. And I think that your mom will adjust really well to going there.
I worry sometimes that she might have some trouble adjusting.
I think that's a really normal fear and concern, but I think that a lot of people find that once their loved ones are there, they get really used to it and actually really end up enjoying it and having a good time at those facilities.
Okay.
Yeah. Have you maybe thought about counseling to maybe help you process some of these emotions you're feeling about your mom?
I think so, yeah. I think that would maybe help.
Yeah.
I did talk with my husband as well, and he's agreed to kind of help with some of the things, at home, like some errands and some small things that he can kind of add to his plate to help out.
I think that's so great. Small changes can help so much in the long run of things. Well, let's put a plan together and maybe incorporate some counseling and some other things for you. Okay? How's that sound?
Yeah, that sounds good.
Well, just remember, I'm here for you. You're not in this alone. And I'm also going to put you in touch with our social worker so they can also provide you with some other resources. Alrighty? All right. Before you get out of here, though, I am going to go ahead and do my assessment, all right?
Okay, thank you.
Okay, perfect.